Hello and welcome to another episode of Low Tech Health. I'm your host, Brad motherfucking Burns. And today, let's talk tickers. Taco Tuesdays. I accept you. Do you accept your defeat? Or 2 feet? I don't know. Oh, I'm a little ragged this morning. I had another night in the cardiovascular ICU and got to cardiovert the patient after going through the whole shebanger to make sure he's COVID negative. Bring, bring. I know you just got to do one sinus, but I can't help it. I want people to get the most out of their hospital experience. I don't want them to be short-sheeted. So anyways, which fucking bothers me when I see it on the news. They're like, COVID tests are down. Everyone is testing negative. It's because they just stick it in their nose and just tickle it. It doesn't do a fucking thing. Coronavirus propagates in your sinuses. So you gotta go about this far. You gotta get a whole finger in their nose. It's a Q-tip, but it's the length of a finger, at least. Keep it in there, twirl it. You have to be a little bit of a sadist, I think, in order to help people. You have to hurt to help a lot of times, which I'll be getting to. This man was a pulmonary endarterectomy, which is where they slice in and pull out some fat globule out of his pulmonary artery, which is a wild thing to see. A carotid endarterectomy on video was the sign that I was going to be able to be a nurse. When I was in nursing school, I was watching that while I was eating some spaghetti, and it looked like cheese coming out of his neck. Carotid endarterectomy, where they fillet the carotid artery, open it up after they've diverted blood flow, clamped above and below, and pull out a big old chunk of cheese. And it doesn't look normal, but I was eating that shit up. Knew I'd make it. So this guy's starting to go a little wonky. His heart rate looked a little a-flutter to begin with, and he went into fibrillation, which is where the top part of your heart just quivers, for those who've been paying attention, and you can have pretty bad regurgitation. Luckily, he was on a heparin drip to keep his blood thin, but the biggest problem is he was dropping his pressure. His blood pressure goes down because as soon as you start to hit above 130 heart rate, you lose cardiac output. When you're in AFib, you don't have what's called atrial kick, which is a good 25% of your cardiac output, which ejection fraction safely is about 60 to 65. It's what you want. You don't want 100% of your blood spit out of your heart, because it's like trying to re-inflate a balloon once the sides stick together. It's going to be a little more difficult than if you keep a little air inside. So pump him up on the pressors to clamp down the afterload of his heart to help keep it from just flip-flopping and bebopping. Doesn't work. We give him 2 milligrams of the magic amnesia drug, Versed, midazolam, which will help you forget what's about to happen. Have pads on him the whole time because it's a CV, and he's not super well. He's not stable, but we know that we're going to need to stabilize him at some point. So they keep crash pads, which are those big pads that you see in the shows that they shock a flat line, which is fucking stupid. You can't shock a flat line. It's called asystole. You just start CPR and push epi. And for anyone who has actually done CPR, it looks nothing like in the movies where they pump twice with their fist and then scream in their face. It's hard work. You first end up breaking the ribs, and then you push at least 2 inches. That's not just 2 inches. It's at least 2 inches. And for our bariatric patients who are 400, 500 pounds, I really think we need a Thai massage bar above the bed so we can get these little 130-pound nurses using their heels, because it's always the guys. It's always the guys who are in charge of compressions. The fuck? Come on, what about equality? Anyways, we shock the shit out of him twice. He's a little pissed, rightfully so. Becomes a little confused, wants to go to work. And this is no time for him to go to work. He needs to stay. I don't know what the point of this was other than I had a talking ticker night, and it was fucking awesome because we stabilized him, chilling him out, his which is important because he was febrile and 101.7 Fahrenheit temperature to start with. Through his bladder, this is not just an oral temperature. We're getting a core temp. This is real. So, man, chill him out, calm him down. I go from 3 drips at the start, which are continuous IV medication administrations, to 12, which is fucking insane, especially for a float nurse. Like, they're not supposed to trust me. Why are you giving me all this work? I loved it, though, and man, oh man, does it feel good. To wrap this up, I'm going to briefly run over what's used oftentimes by physicians in the ICU. It's a mnemonic. It's a fast hugs, BID. You want to give your patient a fast hug, at least twice a day is the idea. And that stands for feeding. You want to make sure he's eating. This guy, clear liquid diet, but while we're shocking the shit out of him, it's really not the most important thing to keep him nutrified. Analgesia is the A, which is pain control. Sorry, it's gonna hurt. That also has to get a little muted, but I did give him some oxy before, and Dilaudid, I did take care of that. But it was really the dexmedetomidine, or Presidex, dexmedetomidine, it's hard to say. That's a sedation drug, which is what the S stands for, to help him calm down. Dexmedetomidine, how do you say it? Dexmedetomidine, dexmedetomidine. Oh. Oh, the thromboembolic prophylaxis is also, I don't give any fucks.
Wait,
So also I don't give a shit. Sedation. Oh. Yeah. Dexmedetomidine. Thromboembolic prophylaxis, because with, again, this afibrillation, you can have regurgitation and you can spit clots in the wrong spots. So you want to keep that blood thin and keep that grin. You want to keep your head of the bed up as well, because while we're in and out of consciousness, you might choke on your own spit. It is something called aspiration pneumonia, and we will load you up with tons of antibiotics to prevent that. Ulcer prevention, pressure injuries, they call them now, is the U. You want to turn frequently, put these little sticky pads all over people, because as far as we've come with hospital care, the beds still fucking hurt. Glycemic control, also important. That was the beginning drip this man was on, was insulin. Oh wow, we're going at 8 minutes. This is a long one. Spontaneous breathing trial. He breathing on his own. He not able to do it without oxygen requirements, not supplementation as it's called in some sorts. It's requirements. We're not giving you oxygen for fun. You need it. Bowel regimen is the B, and fast hugs BID, which is BID means twice a day. Because we want to keep you shitting. Man, it's so wild how all of these things are for stable patients. When it comes down to unstable patients, it's ABCD. Airway, breathing, circulation. Don't forget glucose. Alright, I'm going to wrap this up. This is 9 minutes. Thank you guys, my 1 or 2 fans. I love you so much. I'll see you tomorrow on Wasabi Wala Wasabi My Tummy Wednesday. What?
Was there an I and a D?
Yeah, the I is indwelling catheter removal, which you want to make sure you pull a catheter as soon as you can, because you can cause catheter-associated urinary tract infection, which is very important to those for-profit hospitals. Fuck them if they can't pee. They're not getting infected on our watch, because the hospital gets burned for that, because there has been operationalizing of what is actually necessary for care, because patients are planned obsolescence. We will not give you the absolute best care. We will give you the care that is the most balanced risk and benefit-wise. If it starts to cost us too much money, we're not going to give it to you. This is why America's healthcare is a little fucked. And D is de-escalation of antibiotics, which for a febrile patient, we end up starting them on some new antibiotics. So the rules are sometimes out of the window. For those who are trying to pay attention and translate expert knowledge, it's a lot. You might have to go back, reread, rewatch, and return tomorrow for Wasabi Walnut. What's Hurting My Tummy Wednesday.